What type of questions are asked in the DHA exam? The DHA exam for nurses comprises approximately 150 multiple-choice questions, MCQs, on various nursing topics. It's computer-based and typically conducted in testing centers. Some questions asked for DHA exam. 1. A healthcare provider prescribes famotidine, Pepcid, for a client with dyspepsia. What is important to include about this medication in a teaching program for this client? A. Lowers the stress level. B. Neutralize gastric acidity. C. Reduces gastrointestinal peristalsis. D. Decreases secretions in the stomach. Correct answer is D. Because famotidine, Pepcid, inhibits histamine at H2 receptor sites in the stomach, inhibiting gastric acid secretion. 2. Although a nurse is unable to identify any obvious signs or symptoms of bleeding, a client repeatedly has tested positive for occult blood in the stool. Which laboratory result is a concern considering this client's history? A. Iron level 100 micrograms per deciliter. B. Uric acid level 6.5 milligrams per deciliter. C. Hemoglobin level 8.5 gdl. D. Transferrin level 300 milligrams per deciliter. Correct answer is C. Because intermittent or continuous loss of a small amount of blood over extended periods will lead to a decreased hemoglobin level. 8.5 gdl is below the expected hemoglobin range for men, 14 to 18 gdl, and women, 12 to 16 gdl. 3. A nurse is caring for a client with severe gastritis who vomited a large amount of blood. A lavage is ordered by the healthcare provider. Which response does the nurse expect when using a room temperature irrigating solution? A. Coagulation of blood. B. Neutralization of acids. C. Constriction of blood vessels. D. Stimulation of the vagus nerve. Correct answer is C. Because lavage removes blood from the stomach, and the irrigating solution produces vascular constriction, which helps control bleeding by limiting blood flow to the area. 4. A blood transfusion is initiated after a client has had emergency surgery. What should the nurse do first when the client develops fever, chills, and low back pain? A. Notify a healthcare provider. B. Stop the blood and infuse saline. C. Obtain a prescription for an antihistamine. D. Slow the rate of the transfusion and inform the blood bank. Correct answer is B. Because fever, chills, and low back pain indicate an acute hemolytic reaction, which is potentially life-threatening. Discontinuing the transfusion immediately limits kidney damage. The vein is kept open by running the primary bottle of normal saline. 5. When entering a room, a nurse finds new parents looking at their newborn, who is lying in the bassinet with eyes wide open. What action should the nurse take in response to this infant's behavior? A. Turn on the lights in the room. B. Begin the physical assessment. C. Position the infant on the right side. D. Encourage the parent to talk to the infant. Correct answer is D. Because a quiet, alert state is an optimum time for infant stimulation and interaction with the parent. 6. A nurse determines that a postpartum client is Gravida 1 and Para 1. Her blood type is B negative, and her baby's blood type is O positive. What should the nurse include in the plan of care? A. Type and cross-match blood. B. Obtain an order for ROGM. C. Determine the father's blood type. D. Observe for signs of abo incompatibility. Correct answer is B. Because ROGM will prevent sensitization from RH incompatibility that may arise between an Rh negative mother and an Rh positive infant. 7. While changing a newborn's diaper, a client expresses concern about a small spot of red vaginal discharge on the diaper. How should the nurse respond to this concern? A. Assess for other signs of bleeding. B. Obtain an order for vaginal cultures. C. Explain that this is an expected finding. D. Apply a urine specimen bag to the perineum. Correct answer is C. Because this is related to the influence of maternal hormones, it is temporary. 8. What concept of death should a nurse expect a preschool-age child to have? A. Cessation of life. B. Reversible separation. C. Happening that affects old people. D. Someone who takes one away from the family. B. Because preschoolers view death as a separation, they believe the deceased will return to life. This is part of their fantasy world. 9. A nurse is assessing a client with major depression. Which clinical manifestation reflects a disturbance in affect related to depression? A. Echolalia. B. Delusions. C. Confusion. D. Hopelessness. Correct answer is D. Because feelings of hopelessness are symptomatic of depression. The individual feels unable to find any solution to problems and thus feels overwhelmed. 10. A client is admitted to the birthing unit in active labor. An amniotomy is performed. What physiologic change does the nurse expect to occur after the procedure? A. Diminished vaginal bleeding. B. Less discomfort with contractions. C. Progressive dilation and effacement. D. Increased maternal and fetal heart rates. Correct answer is C. Because an amniotomy allows for more effective pressure of the fetal head on the cervix, enhancing dilation and effacement. Thanks for watching my videos.